Hello, here I am again recording the last video on coronavirus, the after effects. Basically, I'm going to be touching bases on some of the questions that some people ask me. The first question is, how is the United States hospitals and physicians treating this condition? Basically, when you go to the emergency room for whatever reason, they start doing a set of vitals. It includes blood pressure, heart rate. They'll check your blood sugar if you're diabetic. They'll check your oxygen saturation. They'll take out blood and they'll do an X-ray. If for whatever reason your X-ray shows that you have pneumonia, if the rest of your vitals are stable, they're gonna send you home with an antibiotic called azithromycin, and this is the correct spelling of the medication, azithromycin. With any antibiotics, you need to take into consideration that the main side effect of this medication is that it can cause GI distress. So basically diarrhea, nausea, vomiting, stomach ache, burning on your stomach. So make sure you take it with food and that you don't take milk with it. I think it can affect the absorption of the antibiotic. Another medication they're using in inpatients that are stable but not getting better is a medication. It's an antiviral called remdesivir. This medication is proven to fasten the recovery. As the doctor explained it, for example, if they give it to 20 patients, 15 patients will recover sooner and they'll get to go home sooner. One of the main side effect of this medication is that it causes liver damage. It doesn't happen in every person, but they keep an eye on your liver. They'll check your blood work every single day, and if they see that the liver enzymes are going up drastically, they'll stop it. Another reason that they may stop it is if you start showing improvement, you don't have to complete the full dose. And the dose is 5 days, once a day. It is given on your IV. Another side effect of this medication is that it can cause IV infection, or whatever you have your catheter, it can get infected. When you go home, it starts getting swollen or is already swollen. It feels warm to touch, it's painful. What you can do to that is just apply warm compressions and it will take the pain away. Just do it a few times a day, and usually it takes 2 days to get better. And if it doesn't get better, just let your doctor know. Another medication that is not the first choice, but it is in other countries, is an steroid. And it's when everything else is not working, they'll give dexamethasone. That's the correct spelling of this medication. Steroids, what they do with the lungs is that it reduces the inflammation inside the lungs, so it helps you breathe better. So basically, they'll give this treatment, they'll check the patient's saturation, if they can be without oxygen. Another thing they give is oxygen. They'll increase it or reduce it according to the patient's need. They'll give fluids, and then they'll treat whatever health condition you have. If you have high blood pressure and it's not controlled, they'll treat it according to the hospital's policy. The same thing with diabetes. Okay, another question that I get a lot is, how many days are you contagious for? So basically what the health department is telling me, or told me a few times, is that you're gonna start counting the first day you had a symptom. So basically not when you became positive, that you tested positive, but when you had the first symptoms. You're gonna count 10 days from that date, and then let's say if the 10 days are there and you still having symptoms, you have to be symptom free for 72 hours or 3 days. If you, for example, if you get a fever and you're still taking Tylenol, you have to wait until that fever is gone 3 days later, and then you're considered not contagious. Another thing that is happening is that this virus is staying in your system between 4 to 6 weeks. Some people is a little less or a little more, but that's the average. So that doesn't mean you're still contagious. When the virus is still in your system, as long as you're being off, like I said, like 14 days, and then 3 days with no symptoms, you're not considered contagious anymore. Some of the symptoms, they linger around but they're not continuous. Like once in a while, you can be feeling fine for a whole week and then a headache comes back once in a while, or a little cough, an itch in your throat, or anything like that. That doesn't mean you're still contagious. That doesn't mean you still have the virus. Is that some symptoms are lingering around longer, sometimes up to from 4 to 6 weeks. And then if you're recovering from pneumonia, you're gonna still have shortness of breath. Your oxygen may be a little lower, but you have to give it time for your body to recover. And then another thing that I was told by a doctor today is that this is a very new infection, or a very new virus that they haven't studied enough, so they don't know if you become reinfected, if it's gonna be worse or if it's gonna be less severe. So for that reason, even if you already have the virus, you need to take the same precautions. You need to start wearing your mask, cleaning your hands, all the same precautions as you did before, because we don't know what the long effects are going to be after a year from now, a few years from now. So they're saying that you still need to consider keeping your distance, wearing your mask, washing your hands. And this is about it. I don't have any more information to share. If I find anything else in the future, if I know anything else, I'll be happy to share it with you. But thank you for your time.